Hello, my name is Dr. Sean Brown and I'm a hand upper extremity specialist with Tennessee Orthopedic Alliance. I practice here in Murfreesboro, Tennessee. Today I want to share a few nice safety tips with you. Not only do I get to use sharp instruments in surgery, but I'm also an avid home cook, so I love using knives in the kitchen. However, knife safety is very important. So I want to share with you a couple of tips on knife safety today. One thing that most of us really love are avocados. We love avocados in our salads or on toast or even for guacamole. However, getting the pit out of the avocado can be a little bit dangerous. Sometimes people try to use a knife to be able to get the pit out of an avocado. So once the avocado is cut, if you're trying to use a knife to get the pit out and you're holding the avocado in your hand, it would be easy to stab through the flesh of the avocado and lacerate your finger or the hand. So instead of using a knife, I would recommend taking a spoon and taking the pit out with a spoon, and that would definitely be more safe. Secondly, I see a lot of injuries when patients come in and say they were trying to cut a piece of fruit and the knife slipped and they cut their finger or they cut the hand. The fruit itself can be slippery and the knife can be slippery. So if you're trying to cut the peel from the fruit, something can slip. So two tricks here. You can use a wooden cutting board where you place the fruit on the cutting board, and with protecting your fingers, you're able to cut or slice through the fruit. Secondly, you can use a peeler so that way you can peel the flesh of the fruit more safely. So these are just small tips in the kitchen that will help prevent lacerations to your hand or your fingers. However, if you do sustain a laceration to your hand or your finger, here are some reasons that you should seek immediate medical attention. If you are unable to control the bleeding after 15 minutes of compression, you should definitely seek medical attention. If you have numbness or tingling in the fingertips that persists, you should also seek medical attention. In addition, if you do not know if your tetanus shot is up to date, that would be another reason to visit an urgent care clinic or the emergency room. And finally, if you're unable to bend your fingers or straighten your fingers, you should definitely seek immediate medical attention. The reason that we suggest that you seek immediate medical attention for finger and hand lacerations is because there are important structures that lie right beneath the skin. There are your tendons, your nerves, and your arteries. And so some people will think, well, my hand is swollen, that's why I can't bend it. That's not true. If you cannot bend the finger or straighten the finger, then most likely you may have injured a tendon. Secondly, some people say there's swelling there and they feel like that's a reason they can't bend, or they're in too much pain. Those two reasons are not adequate reasons to not be able to bend or straighten the finger. So if you have any difficulty bending, straightening the fingers, or you have numbness and tingling that persists, those are definitely reasons to seek immediate medical attention. With tendon lacerations and nerve lacerations, if they are not addressed within 2 weeks, then it may be difficult to repair them. So if you sustain any type of an injury and you have any of the symptoms we've talked about previously, I would suggest that you seek immediate medical attention. Thank you for tuning in today for TOA tips on knife safety. Stay safe in the kitchen.